welcoming everybody to today. Thank you so much for joining us here this morning for Improving Men's Health at Work. This is part of our Movember activities, and we're going to tell you a little bit about why we're here today in a moment. I'm Emily Pearson from Our Minds Work. Our Minds Work literally exists to create mentally healthy workplaces. So we work with clients to develop and deliver effective culture change, mental health and wellbeing strategies, and they include initiatives as well. One of those initiatives is what we're here today to talk about, is our men's health initiative called the ManBassador program. And we have partnered with the amazing ManHealth to create and to develop the ManBassador program. Gosh, I think we launched it this time last year, so it's been up and running for 12 months now. And we do have a special guest joining us later on in the session to provide a little bit of a case study, really, so that you can start to hear about how engaging men in the workplace with health and wellbeing initiatives can really make an impact. So I'd just like to introduce Kevin, who's here today from ManHealth. He'll tell you a little bit about himself and a little bit about ManHealth as well.
Hi, good morning, everybody. Thank you so much for coming along this morning. And thanks for the introduction, Emily. Yeah, my name is Kevin. I work for ManHealth. ManHealth is a charity that aims to look after men's physical and mental well-being, essentially. So we run peer support groups throughout the northeast of England, but to subsidise that, we deliver work-based training, and so we go where the men are, essentially. So we try to work with organisations and promoting all aspects of men's health and well-being. So it's great to have you along with us this morning, and it's a pleasure to be spending time with you. So first and foremost, I will just see who we've got in the room in terms of where we're at. So I'm just going to start a poll. This is the first poll I've ever launched on Zoom, so it's a big day for me.
This is big.
So
this is big, Kev. Go on.
Hopefully
We're
this
rooting
works.
for you.
Hopefully this works. So I'm going to launch a couple of questions just to gain a little bit of understanding. So hopefully those questions will be appearing on your screen right about now.
If it's not on your screen, this is what the questions are. So number one, what % of your workforce is male? Less than 50%, between 50 and 75, over 75% are not quite sure. Pop your answer in the chat box if the poll hasn't launched for you there. Question number two, how often do you run health campaigns or awareness raising events? Never, rarely, periodically, fairly often, or on a regular basis. So feel free to pop your answer in the chat box if the poll hasn't just popped up on your screen like it's supposed to. We'll just give people a few more moments to select, because that's only two questions there. It shouldn't take people long to do that.
And it's worked. There are responses in the poll.
Well done.
Victory. A little victory for me today. So great. So I think most people have answered that. So just by quick way of the get a feel for the organisations represented in the room. Yeah, we have representation from organisations where majority of the workforce, are over 75%, are male, which is great. How often do you run health campaigns or awareness raising campaigns? Some rarely, some periodically, some fairly often, and some very regularly. So it's great. We've got a real broad church. We've got a good cross section of organisations that are already doing something. So it'd be really good to get that detail and learn a little bit about what the work that you're doing currently in your own organisations. So thanks for that. So with regards to the presentation itself, In a general overview, in the UK, there is growing evidence of inequity in men's health outcomes in a variety of physical and mental health conditions. Okay, so diseases such as heart disease, cancers, obesity does display some clear disparities in the incidence between men and women. So this session is all about exploring a little bit about about the reasons why, and about what we can do in the workplace to close the gap, essentially. There is also data indicating prevalence of poor mental health conditions amongst men, most notably suicide. So again, we will look into these in a little bit more detail. But that's just a little bit of a scene set as to the starting point that brings us here today. So why is the question? I suppose that's the question that we all want to be able to answer. Well, why are men so disproportionately affected? Well, first and foremost, we go right back to the beginning. Men are born with a Y chromosome, and that Y chromosome makes men instantly more susceptible to contracting some certain diseases. Okay, so from the day that the XY chromosome forms and determines your gender and determines that you are male, you are more likely to be susceptible to certain diseases such as Alzheimer's, cardiovascular disease, and cancers. So that's right from day one. Further down the line, there are other reasons why men may be disproportionately affected. So we do need to recognize the link between socioeconomic status and the propensity to develop physical and mental ill health. Okay, so but there is a clear link there. Blue collar workers are more at risk of developing certain cancers. For example, male specific stigmas are barriers to help, and we will have a look at some other barriers that make it difficult for men to present with present to help seeking behaviors. Okay, what are the barriers that stops men from seeking that support that they need? Some male specific stigmas is how will I be perceived? Okay, so men are concerned about the reaction from their friends, their peers, and their colleagues. Okay, so there will be consideration that men give about their standing in the workplace, for example, their likelihood of any promotional impacts or career progression if they are to present with a physical or mental ill health. So there is stigma around those men, and that does and can prevent them from seeking that support that they need. What they may seek out itself is other gendered coping strategies. Fairly well established that men, if they do not address problems or address the need with their physical and mental well-being, they will find other ways to cope. And some of those coping strategies will be unhealthy coping strategies. So we do see increase in the use of drink and drugs and risk-taking behaviours as a way of dealing with the stresses and strains that come with perhaps developing physical or mental ill health. Poor general health is something that we do need to factor into the conversation as well. So we're talking here about lifestyle, essentially. Men are physically less active than women. So according to the recommended guidelines of 150 minutes exercise per week, less than a third of men are meeting that threshold. And when it comes to the recommended portions of 5 fruit and veg a day, the average man is consuming around about 3. So they're generally speaking, the general health of men isn't great. Lack of health education, that's all about these natural interventions, I suppose. If men do not have a natural point, I suppose, where they are taught about their own health, they're not taught and educated about risk assessing their own well-being. Within the workforce, within the workplaces that are represented here, risk assessment's probably part of your everyday working procedures, and men will probably carry out risk assessments and risk registers and things like that. commonplace. But perhaps what they are less likely to do is take a step back and risk assess their own health and well-being from a physical and a mental point of view. Men are more likely to take risks with their health. Okay, so there we're talking about minimizing symptoms. Okay, not acting on symptoms soon enough, and that can present in less engagement in primary services until crisis. Okay, so the analogy that was made in Men's Health magazine was that if it were cars, women would look after their bodies in the same way they'd look after a car. They would get a regular service, they would maintain it, they would look after it, where guys might be a little bit more reluctant to run it into the ground and only seek help when they've absolutely broken down. So there are some distinct differences in the way that men and male and females present, and different lifestyle changes that will go some way to explaining that disproportionality as to why men are so adversely affected. So I did say that we would look in a little bit more detail at the barriers. So what are the barriers to health and help-seeking attitudes amongst men? So the research that was shown shows that one of the main reasons that men do not want to approach GPs for health checks or go to hospital appointments is a fear of diagnosis, treatment, or a mortality. Fear of finding out that there is something wrong. Okay, so there is something there about the fact that not knowing is better than knowing. Okay, so we know this from when men present, for example, with cancer symptoms, they will tend to present with cancer symptoms at a later stage, which makes the chances of recovery reduced. So that was one of the main reasons, is the fear of finding out that something was wrong, which was really, really interesting, and something that we try to a narrative that we try to change in our day-to-day work. Stigma, we've mentioned. Shame and embarrassment. Yeah, there is an almost inbuilt propensity to compare yourself to the man next to you, compare yourself to your friends and your peers, and if you've got something that is affecting your physical or mental health and they haven't, okay, you may not feel comfortable sharing that. So it may be an embarrassing symptom, or it may be something mental health related that you don't feel comfortable opening up about. So again, we want to try and normalize conversations so men feel more comfortable to overcome the stigma and the shame. And so something to think about with the workplaces that you come from. Symptom minimization, yeah, we mentioned this already as well. A lack of early detection. So men will prioritize work over their own health checks. So they will get round to investigating the lump. They may finally get to a GP appointment days, weeks, months down the line after finding something that probably warranted an earlier investigation. But it is fairly commonplace for men to minimize the symptoms, give it a week or two to see if it'll go away, and that lack of early detection does play out in the statistics around cancer incidents as well. So a lack of health education. So, it's important that we don't blame men for this. Men do not have and probably not given the tools in order to look at themselves from a health point of view and see where they are, both physically and mentally. So there was probably nothing in school education when Generation X were growing up. It was probably light touch if there was, but men are not equipped with the skills to understand their own health and recognize the importance of symptoms, risks, treatments, that type of thing, because perhaps they've never had the opportunity to learn and understand it. So a general lack of health and education. And a lack of service availability and effectiveness. Yeah, we mentioned men will prioritize work. So we know that services are stretched. We know that GP appointments can take days, weeks, or months to get hold of. And if men cannot access an appointment outside of their working hours, then perhaps they will not look for that appointment at all. Okay, so the services within the structure and the framework of the services within which we work, which these men work, are not working effectively for them, and putting barriers in their way to getting that help that they might need. Societal work and social influences, yeah, again, I suppose linked back to stigma a little bit, but we are making inroads on changing the societal view on what it means to be a man, and a man needs to um, be healthy in order to provide for his family and provide for his kids. But there is still work to do to make sure that, as I say, we can normalize these conversations. We can really drill home some key messages um, so that men do feel more comfortable in opening up about uh, anything that they're going through from a physical or a mental point of view. It's all about, as I say, changing societal views um, so that men feel that they can speak out. Because the alternative is avoidance, and they will avoid the problem, they will avoid the topic, they will avoid treatment, because all of the things that we've talked about, they will naturally back away from seeking the help that they might need because of all of those things that we've just touched on. So there are barriers to health and help-seeking attitudes. So we do need to make sure that we can do everything we can, both from a society point of view, from a workplace point of view, and help our men individually as well feel that they can overcome these barriers. So we talk about men shouldn't suffer in silence. So if men do not feel that they can overcome this stigma, if men do not feel that they can seek and access the help that they need, what's the consequence? Well, the statistic is there. 1 in 5 men in the UK will die before the age of 65 due to mostly preventable health problems that go unvoiced. Okay, now, 20% of men not reaching the age of 65, which used to be retirement age, is a startling stat because 65 isn't particularly old. I think you'll agree. So again, we need to look at helping our guys understand that the reasons that 1 in 5 people are not making it to the age of 65 are largely to do with preventable health problems. And this is something that we do a lot of work on in our organizations that we visit and we work with. We look at the 5 biggest preventable killers of working age men. So we talk about health education, and perhaps that there wasn't a natural point to introduce this education as the men were growing older. This may be the first health intervention that they've received, where we talk about 5 biggest preventable killers of working age men. So what are they? First and foremost, heart disease. Heart disease kills 1 in 6 UK men. Now, this isn't a UK phenomenon, it's worldwide. The statistics are quite shocking. But when we do this training course in the workforce, we always ask the guys, what do you think are the 5 biggest preventable killers of working age men? Invariably, the answer that we get is stress. So we do talk about and will talk about work-based stress. So the guys are making that association between stress and ill health, which is great. But specifically the disease that is robbing us of 1 in 6 UK men is heart disease. And there are numerous reasons for that. Lifestyle, you are at increased risk if you've got a history of poor heart disease, but we do need to factor in some of the things that we can influence and we can do something about around working hours and stress, as the statistics says there. The second biggest preventable killer of working age men, prostate cancer. Prostate cancer kills about 32 men each day and 47,000 diagnoses each year. So 1 in 8 men will get prostate cancer. 1 in 4 black men. So if one of the key education pieces that we're keen to promote is that if you have black friends, family, colleagues, they are twice as likely to get prostate cancer. The education is critical. We lose around about 12,000 men every year to prostate cancer, and just by way of quick comparison, that's around about the same amount of women that we lose to breast cancer. But women's understanding of breast cancer and the checks that they need to do for lumps and bumps, and the importance of getting those checked is much more heightened. The understanding about what a prostate is and what it's for, and how we can minimize the risk of prostate cancer amongst working men is quite low. So, education is critical, and as I say, we strive to make sure that we do what we can to promote the importance of acknowledging the risks and crucially acting upon any symptoms that you notice. Lung cancer. So in males in the UK, lung cancer is the second biggest common cancer. 79% of lung cancers are preventable. The default response really that we get is from smoking and vaping, cigarettes. But that's not to detract from other risk factors as well, which can be workplace centric. So we need to think about air pollution. We need to think about the industries that we may be working in: heavy industry, chemical industry, manufacturing. All of those things may increase the men's risk of air pollution and therefore an increased risk of developing lung cancer. So whilst the natural and go-to risk factor is smoking, and rightly so, given the statistics, there is something that we need to factor into the conversation around the workplace and what we can be doing in the workplace to reduce that risk as well. Bowel cancer, according to the NHS, the most preventable of all bowel cancers because it is so heavily linked to lifestyle. The latest figure that I saw on the NHS website was around about 54%. So 54%, if you could reduce your risk contracting bowel cancer by 54%, I think that is something that we'd be really keen to shout about with our men. It's currently 1 in 15 UK males will be diagnosed with bowel cancer in their lifetime, and 9,000 will die of bowel cancer. Again, survival rates closely linked to when men present. So we need to really embed and normalize that message of, don't minimize the symptoms. Let's get them checked out straight away and get in to see the GP. So again, are there opportunities for us there to promote these messages through our organizations? And finally, for the fifth biggest preventable killer of working age men is suicide. Okay, so suicide is a complex one. Of course, it can be triggered by various mental health problems, work-related stress, drug and alcohol problems. Commonly, emotional distress caused by life transitions. So life transitions are changes in a man's lifetime. Some of those transitions will be unwanted transitions. So if you think, for example, separation, grief, divorce, access to children, all of these life transitions that men perhaps didn't plan for will come with associated emotions and problems and feelings that they will need to they need to help with coping with. So suicide is a complex cause of death that it's we could spend a lot of time on trying to understand the reasons around male suicide specifically. Construction industry has a particular issue, I suppose, in terms of numbers. But all broadly speaking, 76% of deaths from suicide each year are men. Yeah, and we're doing a lot of work on suicide awareness and prevention, because the men at most risk are aged between 45 and 54. So if you think about that age group, think about that group that may have had some transitions in their lives with regards to, separation, unemployment, those types of things, those added external stresses that may compound any underlying mental health conditions that might be there as well, and unhealthy coping strategies with regards to drink, drugs, that type of thing. it's a really difficult one to understand, but it does sort of shine a light on the fact that life can impact people almost every day. You know, life is tough, and at certain points, particularly within that age bracket, seemingly looking at the statistics, um, we have um, transitions that we need to try our best to cope with and support our men with, because we do believe that suicide is preventable. So those are the 5 biggest preventable killers of working age men. We can do something about that. And again, in terms of risk minimization, it's something that we might do every day in our working lives. But you know, can we apply um, that same thinking to risk reducing the risk of mental and physical ill health within our men in the workplace? Because there is an impact on the workplace. So in the survey that we carried out, over 300 men, the statistics say that only 37% reported good physical health. So only 37% of men reported good physical health. Only 34%, so just over 1 in 3, reported good mental health. Okay. And 44% are living with a diagnosed mental health condition. So these are people that have overcome whatever barriers that they may have faced, and actually got the diagnosis. But there's still 34% that think that they may have a mental health issue that hasn't been properly diagnosed, or they may not have disclosed to a GP or a medical professional. 44% of the men had experienced suicidal thoughts at some point in their lives. So, again, really stark figures, and that will help us sort of focus the mind and think about the challenge ahead. Yeah. We also asked the men what had the biggest negative impact on your mental health over the past 6 months. 56% said it was work-related stress. 44% said it was money worries. 41% said lack of exercise. Again, I think that sort of brings together the challenge that we've been touching on over the last 20 minutes or so. Men will spend a lot of time at work, and work-related stress was the main response as to what's had the biggest negative impact on your mental health. Both hand in hand with that might be money worries, job uncertainty, risk of redundancy, reduction of hours. All of these types of things will need to be factored into the conversation. And we touched on the fact that men may struggle to access GP and healthcare appointments due to their work commitments. But again, work commitments may impact their ability to get regular exercise and to dedicate some time to that self-care element that they will need. So you know, all of those things work could play a part in supporting that. And the percentage of men whose physical health was impacted by their work, over half had attended work when physically unwell. 70% stated that their work had been impacted by poor physical health. Yeah, so 7 in 10 people were reporting that the fact that they were physically unwell was having a knock-on effect to the effectiveness of doing their job. Yeah, so again, real stark statistics that help focus the mind. So just by quick way of summary, we've looked at what are the 5 biggest preventable killers of working age men. We've looked at barriers that can sometimes make it difficult for men to feel comfortable in seeking that support that they need. And we've looked at the impact that not seeking that help and not getting the support they need for their physical and mental well-being can have on their day-to-day work when they attend work in their various offices and sites up and down the country. So at that point, I'll hand over to Emily to talk about the engagement of men.
Thank you. Thanks so much, Kev. You know, that really does kind of give us a little bit of a journey there around why we're actually here today, and why we're here to really start to create a bit of an understanding of the inequalities that many men do experience, not all men, but many men. And what we need to do to make those changes, because as you can see already, I just got you to work out, you know, what 1 in 5 of your male workforce could potentially unfortunately have died because of one of these 5 biggest killers before they reach retirement age with you. Some of those kind of numbers you were coming up with were really, really concerning. Not only does that it then impact their families, their children, their communities as well, but also the impact that that has on the workplace as well. So what I want to talk about, well, okay, we know that this is a huge problem. There are some key areas that we need to tackle. And one of the biggest problems that we hear time and time again is, well, we put on a time to talk day. We invited people to come along for a cup of coffee and talk about your feelings. No men turned up. Ooh, I wonder why. But we often get the problem that there are people in workplaces who are trying to raise awareness around this stuff, but are often not engaging men in their mental health and wellbeing initiatives. So I just want to, before we move on as well, we'll send over this survey. We do have a little bit of a snapshot from what the survey covered. But there were some of the key areas that I think more kind of solution-based, which I'm going to start talking about next. I mean, it was blatantly obvious that the majority of men are at work struggling with their mental and physical health, and work-related stress was a huge impactor. So these aren't just about things that we were unable to have control over as employers. There is a lot of control that we can have on making improvements from a workplace strategic perspective. But some of the other things that I just wanted to cover that were in there, and some of these are really about tackling some of the myths, is the myth of men don't talk. Men don't talk about the feelings. And what we often find is, well, why do you think none of the men turned up for your cupcakes and coffee and talk about your feelings time to talk day? Well, because they don't talk about the feelings. But actually what this is doing, this is blaming men rather than blaming the cupcakes and the cuppa and something that you would get women all day. It'd be hard to get women away from the cupcakes and talking about our emotions and feelings, because for many women, we do that very, very naturally. So what we also find is there are a lot of myths around what many men do feel that they need, and that we need to really start tackling. What we found in our survey was that when men were struggling, men did actually talk. There was only 28% who didn't speak to anyone. The majority of the respondents said that when they were struggling, they spoke to their friend, was their top one. So men sought support from a friend were 40%. 39% from their partner, which was the second one, 27% from a family member. So that's all external stuff. But what this shows us is that men will talk, they will ask for help and support, but there's something there about a trusting relationship and the environment and ecosystem that needs to be there for that conversation to happen. When it came into the workplace, 23% was the top answer for their manager. They would speak to their manager. Only 6.8% said that they'd spoke to a mental health first aider or advocate. So again, there's something about building trust and building rapport. And this will all kind of make a lot more sense when it comes into how we actually engage men in the workplace and how we can actually do that. Because also another answer is, well, because they're not bothered about their mental health or their physical health, they don't want to engage in these initiatives because they're really just not bothered. But what our survey found was that 68% wanted to improve their mental health and 57% wanted to improve their physical health. 44% said they wanted to improve their weight as well. So it's not that men don't care about their health and well-being, they absolutely do. But we've got to make sure we're creating the right environment, tackling all of these barriers and making these interventions really relevant and engaging for them. because as we see, it is going to impact work. It's going to impact their families. For many families still out there, men are often the breadwinner. If they're not healthy, they're unwell. This will also impact their friends, their families, their children as well. And also it comes to a cost for workplaces as well. You know, and another one of the kind of myths that I wanted to tackle a little bit is, you know, we do know from our survey that men came to work when they were mentally unwell. So even though they were still at work when they're mentally unwell, the top answer wasn't because of stigma. The top down. That was 47%. 33% said they didn't want to be seen as weak. So there was still that big kind of contributing factor of this is about being a team, this camaraderie. They have a responsibility, you know, rather than this is just a weakness. So we've got to understand what the problems are so that we can tackle those barriers better. So my kind of section here is then, okay, if we know all of this stuff, how do we tackle it? How are we kind of breaking down some of these barriers? So we're just going to run a second poll. My second poll is really a follow-on from the first one. So we already know that we've got a lot of male-dominated workforces in here already today, and that the majority of you are actually running a lot of initiatives when it comes to mental health and well-being, which is absolutely brilliant. But then what I want to know is what, you know, are your initiatives being effective in engaging your male workforce? So how effective are the initiatives are at your organization engaging your male workforce? Not very effective, fairly effective, very effective, or not sure. Second question, how do you know or measure the effectiveness? We don't. Feedback from our men. Under you're just not sure. Because really, this question is the most important one. Nothing happens if we don't get engagement. Yeah. We can't raise awareness. We can't share information about support. We can't help men to be better educated about signs and symptoms and how to live healthier lifestyles as well if they're not there. So how effective are the initiatives or events? 57% say not very effective. This is what we hear time and time again. 29% are not sure. We have just 14% saying fairly effective. So the question number 2, how do you know and measure the effectiveness? We have 43% saying not quite sure. 14% undertake a full review of events. That's really great to see, because that's the only way that we will know. And 29%, you know, asking the guys as well. And so my problem is here, there's a bit of a discrepancy. If they're not very effective in engaging the men in the first place, then how are we measuring that they haven't turned up? Maybe this is what the feedback is, and you were undertaking the full review of your initiatives to say, actually, the guys didn't turn up. That didn't work. Put your thoughts on that question in the chat box for me, please. Let me know a little bit more detail around what the problem is. This is something I'm really, really interested in, because as part of the ManBassador program is about how we actually engage the male workforce to do that great work that ultimately saves lives. So just moving on, let's get into my 5 top tips on how to engage your male workforce when it comes to mental health and wellbeing initiatives. So there's a couple of things that we need to do first. We must stop blaming men for not seeking help due to characteristics or deficits in themselves. Yeah, men don't talk. They don't know how to express their feelings. You know, we put this on, they didn't turn up, it's the men's fault. It usually isn't, right? So we need to start really looking at the characteristics of the limitations of therapy, the services that are available, and our workplace interventions that are being provided. Yeah, if it's not relevant for them, they're not gonna turn up for them. Next slide, please, Kev. One of the things that we also found through our research and research from the Samaritans about reaching men before they reach crisis, and the Centre of Male Psychology, who I do suggest you go check out Dr. John Barry on LinkedIn and follow their page, the Centre of Male Psychology, is that if we want guys to talk, we've got to build the environment for that to happen. And men engage in conversations very, very differently to how women do that. So I've worked in health and social care for over 25 years now. I feel very old when I say that, and have worked predominantly in male dominated services like homelessness, drug and alcohol services. And what I found throughout working in those services, that to engagement in those services, being sat face to face, let's talk about your feelings and what's going on in your life, really, really difficult to do. I always carry, and still to this day, carry a pack of cards around with me. So if I feel like I'm in a situation where I want to get the conversation going, I always bring out the cards. Everybody knows how to play at least one game, even if it's just Snap or something daft like that. But what this does is it creates more of a shoulder to shoulder activity. Yeah, the focus is then on the activity. It's usually a bit of fun as well. Once we've got that activity going, we're starting to build camaraderie, which builds trust and makes it easier for men to talk. So, put 50 women in a room and we will sit and talk all day. Within 10 minutes, we'll be talking about vaginas and periods, guaranteed. Yeah, and we've never met each other before. Women are very, very good at doing this. Men need a different approach. So this is about building that camaraderie. We need to build trust and foster an environment where it makes it easier for men to actually talk and get the help that they need. Ultimately, yeah, once we've got that engagement, that's when we can do the education piece. Yeah. And the education is really, really important. One of the reasons why we actually set up the ManBassador program was Paul Bannister, who's the CEO and founder of ManHealth, who unfortunately can't be here today. He's probably having a good nap because he did the CEO sleep out, didn't he, last night, Kev? So he's probably getting a warm bath, trying to warm himself up after his night out on the streets. But Paul and I, for many years, had said, how do we work together? How do we bring our minds work and ManHealth together? And we didn't want to just create something just for the sake of it. It actually took us 2 years to come up with the idea for the ManBassador program. And how that worked was, Paul and ManHealth were already out there doing short education sessions called the 4Bs, Blokes, Brains, Balls and Brawn. Yeah, straight away, really engaging. That's about me and I'm going to attend that. So really great way to engage around health. But what we found was that we've gone to the Starbucks one day just for our usual coffee and a catch up, what's going on. And a guy came over to Paul in the Starbucks and had said, oh, you're Paul Bannister from ManHealth. And Paul didn't recognize his face, but he said, yes, I am. And the guy said, oh, a couple of months ago, you were actually doing a 4B session at our workplace at Hitachi Rail. I recognised I'd been sticking my head in the sand about some of those symptoms you talked about. I went to the doctors. He was actually diagnosed with stage 3 prostate cancer, which luckily of his prostate, and he's still alive today. He was there saying thank you to Paul. By this time I'm in tears, and she's saying thank you. And the power of that moment really was, oh, my connection is unstable, hopefully I'm okay and I'm back. The power of that moment was what made me and Paul realize that what we needed in workplaces were ManBassadors, guys who are actually doing this work with their colleagues to actually get this education out there, because it will save lives. But like I said, to get this education there, we've got to work, we've got to get that engagement there. So by educating men about their health, they're more likely to live longer. Yay, I've got a very, very long time. It'll positively impact their families, their children, their communities, and be more productive at work. So there are so many great reasons to tackle this issue that we're talking about today. Okay. So 5 top tips. One of the first things to do is, okay, some of you said you're running initiatives already. Evaluate your current initiatives. Yeah, are your current initiatives, are they relevant? Are they targeted and engaging for your male workforce? Often this is the big problem, that companies will come to us, you know, HR, wellbeing lead, what our menopause session had hundreds of women on it. There was no men on it. And when we're running men's health campaigns, we're just not getting the turnout that we would hoped. So, you know, really being able to evaluate your current initiatives to understand, you know, are they engaging your male workers? And if they're not, we need to figure out why. Also think about your current initiatives creating barriers for your male. You hear this so often, that, well, yes, we can do that, but it means they've got to come off the line, the production line. But it's like, well, okay, this is about equality. You can't say that people in who are sat, you know, at a laptop all day have better access to initiatives, because you don't want to take people off your production line to give them that same access, especially in a world where many organizations have ED&I policies. This is absolutely about making sure that there is equal access to these interventions and inclusion in them as well. What we also find when it comes to men accessing GP and primary care services, it's often work that gets in the way. So men actually attend the GPs and primary care services at the same rate as women do once they've retired. Yeah. Actually, work can prevent them. So, for example, my husband is an HGV driver. He goes out to work 4 o'clock this morning. He was away out, and I won't see him again till Friday. His workplace is his truck. What is he going to do if, you know, he needs to speak to a GP? He can't make an appointment here. Luckily, we have private healthcare so that he can get access online to a GP. But think about, you know, with your initiatives, you know, are they actually making sure that your EAPs are available to them? You've got healthcare available to them if they're not able to easily take time out to get into these services and healthcare appointments. Does your current mental health and wellbeing strategy account for the health inequalities men experience? You know, and I think we've already seen this. 45-year-old woman here, perimenopause is a reality for me. Yet we know that the amount of awareness around menopause has been significant, so much so that we've seen it trending. It's become a huge trend. But my worry about this is, and quite rightly so, you know, women do need the support. We do need the right treatment. We need people to understand the craziness of what it can feel like when we're experiencing this stuff. But what I have found over the past 2 years is that for many organizations, even male-dominated organizations, they have spent and invested more on menopause when they've got 10% of the workforce being female, than what they have on men's health, where 90% of their workforce would lie. So how do we make sure that your well-being and mental health strategy, it also includes men, and we're looking at it, you know, investments around, you know, really kind of measurable outcomes that are related to problem solving as well. Especially one of the problems that we mentioned earlier, which was all around, you know, work-related stress. You know, if you really want to take action to support everybody in your workplace, preventing work-related stress is a huge, huge preventative way of making sure there is an initiative that you can measure and benchmark and continue to engage in that for everybody, and include in your suicide prevention strategy as well. But ultimately, you know, we need to just consult with your male workers to avoid assumptions about their needs. You know, ask them, you know, what kind of activities would you be engaged in? Not, do you want to know about prostate cancer? Actually, it's what the important bit is the what's going to get them there. Yeah. So we've got some great examples there. Thanks, Kev. So top tip number 4, we've got to build a culture of trust and psychological safety. The way that men and women are a little bit different here is what we find is you can put two women who are complete strangers in a room together, face to face, and they will talk and share intimate details with themselves. This is how they build trust and psychological safety. You know, you'll probably see this, you know, quite often. Do you have children? You're sharing pictures of your pets. You know, we all love a bit of puppy porn, don't we? You're sharing pictures of that. I didn't mean that in the wrong way. I just mean look at other people's dogs. You know, start to share these intimate details, and that's how often women will build trust. By sharing these intimate details and building that relationship that way. For many men, building trust is more around building camaraderie. This is about being able to trust that you've got somebody there for you to support you before you start sharing intimate details about yourself. So how do we do this? Promoting positive male role modeling and sponsorship of men's health and initiatives from the top. It has to start there. With other mental health and wellbeing initiatives, we need to ensure that we are role modeling, we've got that sponsorship, and it's moving it from the top and building these positive male role models. And these could be senior leaders who are able to share their own experiences of their health and wellbeing recovery journeys from a man's perspective. This is really important as you're managing culture creators. They are the people in your workplace who are able to recognize that a colleague may be struggling, be able to have conversation with them, and be able to prevent work-related stress. So your managerial investment really is a huge priority when it comes to any mental health and well-being strategy, but also, you know, it's specifically for men when we're talking about here. In our survey, who said that? Answer in the chat box if you know who it is, because I can't remember who it was. But what our survey told us was that when we asked the guys what support did they want from the workplace, having better managers was number 1 answer. So developing managers with the knowledge, skills, tools, and confidence to actually foster a mentally healthy culture within their teams was very, very important to the guys in our survey. Obviously, we need to ensure buy-in at all levels of the organisation for a commitment to men's health. I don't know if you know this, but when it comes to men's health in the UK, we are now at this current moment petitioning to get a men's health minister. Can you believe that we don't have a men's health minister, yet we have a women's health minister and have done for a couple of years now? Out, you know, this isn't just about workplaces, this is about the whole of our society here. This is a huge movement that we need to make to really level the playing field when it comes to men's health. And I don't know if you know this as well. I know we've mentioned about mental health problems and suicide there. We often hear that, you know, the world is built by men for men. But unfortunately, when it comes to mental health, that's the complete opposite. When it comes to psychiatry and psychology, there has never, up until 2 years ago, been a specific module around male psychology. So psychology has been built around women's health. rather than men's, which is the complete opposite way around. So, you know, there is so much more that we need to do on a much kind of broader spectrum that we can really link into our workplaces as well. Number 3, use male-friendly activities. Okay, these are initiatives that are specifically targeted to men. Think about it like you are marketing something. This is your marketing skills. You know, there's a reason why the women's shampoos and the men's shampoos are in a different aisle. They're different colors, they're different smells. And women, yeah, we need to think about this in the same way. You will also find just here today that the ManBassador program here, you can see black, bright green, and lovely purples. That's probably not going to get engagement for many men who are out there. Consider using shoulder-to-shoulder, goal-oriented activities that encourage natural conversation. We've seen some great examples of this from some of our ManBassadors already out there in the workplaces. Blackpool can walking the 3 piers in Blackpool. So this was more kind of shoulder-to-shoulder activities, getting some physical exercise in there that encouraged a natural conversation. We've also had James Jones, who had some 2 departments have a 5-a-side football match. And Tracyco will tell you, Simon from Tracyco will tell you all a little bit about what they've been doing as well. Use activities that harness male camaraderie. Remember, the camaraderie builds the trust. The trust has to be built before disclosure will happen. Yeah, we can't just say, men, you need to talk about your feelings, and not create that environment for that to actually happen. We need to make sure, as you've seen from today, that education is really embedded into your men's health activities. So your activity is the hook. We call it the hook at ManBassador. What's the hook? The hook is usually your male-friendly activity, like we had an organisation that they had a dartboard tournament. Yeah, that was the activity. That was the hook. Once the guys were there, then we can hand out the information. Did you know that this is a sign of prostate cancer? It's Movember, you know, I've got a tash on. Let's talk about my tash. So making sure that the education piece is really embedded into there. And provide access to online information and signposting as well. That, you know, is really, really important part of, okay, well, what is available? There are many, many, many more men's health groups now, like ManHealth, Andy's Man Club. There's loads of them across the country that really should be a staple of signposting, because this is where those male-friendly activities externally can really build into them getting social support outside of the workplace as well. Number 2, be welcoming and accessible. Like, this shouldn't be come and talk about your emotions. Yeah, who's going to turn up for that? Probably me. I'll talk about that all day long. But, you know, we need to also make it welcome and accessible for people. So creating a sense of fun and playfulness, as you've seen from the activities that you can do, that's going to get the guys there. Making sure that, you know, we're thinking about football isn't going to be for everyone. Yeah, darts isn't going to be for everyone. Maybe it's a competition on gaming instead. You know, think about what, especially if you've got, you know, a very kind of tech-based organization, you know, asking your male workers right at the start, what kind of fun and playful activities would you come along to? Yeah, it might be pizza and watching some kind of action film, or it may be come and learn about how to braid your daughter's hair. You know, what is going to get the guys there? Once they're there, we're able to do the great work. But go where your male workers are. And this is the beauty of the ManBassador program, is the ManBassadors are exactly where your male workers are. They are so on the ground that it actually takes all of these activities exactly where it needs to be. Instead of saying to the guys, yeah, we've got this thing going on here, but you know, you need to come away from where you are. You've got to go into an office area somewhere where you maybe only ever go once in a blue moon. You know, let's meet the guys where they actually are. Communicate clearly, using practical information, that it's accessible and welcoming, and make sure you've got online information accessible outside of work as well. You know, really practical information. Yeah, this is what it is. We're meeting here. You know, we're maybe raising money for ManHealth because it's Movember. Making sure that you clearly communicate in practical terms how to access what's going on. And do make sure that they provided the time away from the day-to-day job to actually go to these activities as well. Often that is a huge barrier. Well, I wanted to go, but I couldn't get off the line. I wanted to go, but it was up in HR's office somewhere, and I just wouldn't have had the time to get there from my truck. HGV drivers, how are we making sure that this stuff is getting to them? Nobody's checking in on them, you know, at work. How's your day going? But they'll definitely get a phone call to say, why is the delivery late? Yeah. So how do we make sure that they're welcoming and accessible? Number one, hopefully these have all worked so far. And then we need to keep it going. Yeah. We're not just doing this because it's Men's Health Month and we're going to forget about it until Men's Health Week in June next year. It has to keep going. Yeah. We should be evaluating the impact. We need to embed those initiatives and promote the ongoing engagement, because this really is about building trust in what you're doing. Yeah, keep doing it, keep doing it, keep doing it, build it, and people will come. It's really important that we embed male peer-to-peer support. That's exactly why the ManBassador program was developed, because they are the key people to do all of this work, especially when they're led by a team, by a ManBassador lead, and they're actually built in to your mental health and wellbeing strategy. You know, making sure we've got regular reminders, because just saying it's happening in 2 weeks' time, people forget. You know, we do need regular reminders, and do promote male participation in initiatives by word of mouth, by male peers. That's some of the greatest. Oh, I really enjoyed it. Yeah, we had this little bit of a competition. We had good fun. I met Bobby. I didn't realize that he has the same lived experience as me. You know, really word to word, word of mouth from male peers is a really important part of making sure you keep that engagement going and you start to build it as well. Can I just check in, Kev? Has Simon arrived? Oh, he has. That's brilliant. Yeah. So
yes,
I just want to, oh, thank you. I just want to do a little bit of a kind of summary there. As you can see, you know, this isn't just as easy as, you know, doing something because it's Men's Health Month. This has to keep going, or else it'll be like, oh, that's interesting. Oh, it's all gone now. Oh, that's interesting. Oh, it's all gone now. You know, one of the things that we saw with menopause was that many companies now have a menopause policy. They'll have make sure that there's specific menopause support and their EAPs available for them as well. We've also seen that managers have received training around how to support any woman who may be experiencing menopausal signs and symptoms and may need some additional support. We've also seen menopause champions now become a big thing, and quite rightly so. We've also seen loads of education around menopause and just general the impact that female hormones can have on our mental health throughout our whole reproductive life cycle. This is massive. Yeah, we need to do the same for men. It's really important that we look at this in the same way. We need to level that playing field, because ultimately we're talking about, you know, menopausal symptoms are absolutely horrendous, and for some women it can cause suicide. You know, there are lives that we need to save here, and it's the same with the ManBassador program as well. It's all about saving lives, because that benefits everyone, including your workplace as well. So I'm just going to tell you a little bit, 2 slides, what the ManBassador is, how it works, and then I'm just going to introduce Simon. Feel free to pop any questions in the chat box in the meantime as well. So what is the ManBassador programme? So the ManBassador programme is a peer-to-peer men's health intervention for the workplace, which takes a gender-specific approach to improving health and saving lives. So all of that stuff we've just talked about today, we do all of that within one programme called the ManBassador programme. It's evidence-based, so we have been working quite closely with the Centre of Male Psychology. Like I said, Dr. John Barry, go follow him. Absolutely amazing work that they're doing there. And the evidence around reaching men before the reach crisis through the Samaritans. So it is based around a lot of research and evidence that shows what works. We also have based it around tackling male-specific stigma to increase help and health-seeking behaviours, because that is a key issue for us. And what the ManBassador programme does, it really uses that positive male role modelling, that they then change the narrative that being strong is being silent through those ManBassadors. It doesn't just target mental health. This actually targets the 5 biggest killers of the most at-risk men. So if you think about your workforce, your blue-collar workers will be much more at higher risk and probably harder to engage, yet exactly one of the reasons why we need ManBassadors down there doing that great work, engaging them, building that trust and camaraderie. It's designed to reach out to men way before crisis. This is because it's inbuilt into your workplace, and your ManBassadors then create their own men's health initiatives for the rest of the year. So it could be, I don't know, we've got what we've got coming up next year. We've got Eating Disorders Week in March. This is often represented as a female issue, yet there are many men out there struggling with eating disorders, maybe using steroids as well, so which we've seen a heightened risk of. So this is about the ManBassadors being able to look at, okay, well, what is going on? What do we need to raise awareness around from a man's perspective as well, rather than, you know, just focusing on the 5 biggest killers. It is designed to reach out way before crisis, because this builds trust that it then increases disclosure from happening. Harnesses the power of male shoulder-to-shoulder camaraderie, and that's because their activities are male-friendly activities. Their ManBassadors are working with their male colleagues to go, okay, well, what would you like to do? Okay, we'll do some axe throwing. I'm sure there had to be a risk assessment for the axe throwing bit, but that's what Taylor Made did. They had some axe throwing, and they had the guys there throwing some axes around, bit of competition, healthy competition, but that really started to harness that shoulder-to-shoulder camaraderie. And because it's owned by your men, it makes it relevant, impactful, and absolutely on the ground. It tackles all the problems that we've talked about so far. So how does it work? So it's pretty simple. We work with you to find a ManBassador sponsor. The ManBassador sponsor is usually a senior leader who's committed to the programme to be the face of the ManBassador programme. This works really well if it's a senior male sponsor who can also say, this is why it's important to the workplace and to me, yeah, and be able to share their own lived experiences as well. We work with you with your ManBassador lead. Your ManBassador lead is usually someone in HR, Wellbeing, who then becomes responsible for the blueprint and the ManBassadors. You know, we saw this a lot with mental health first aiders in the early days. They were trained, waved off good, responsible for them, looking after them, checking in on them, and also making sure all the infrastructure, governance, safeguarding, and making sure that we're able to measure the effectiveness of the programme as well is completely missing. So we have a ManBassador blueprint. One of the great things about the blueprint is if you have a lot of mental health first aiders already in place, or even menopause champions that you've just trained and don't have all of the governance and infrastructure, how to collect data, you know, all of that great stuff in place, the ManBassador blueprint becomes the big umbrella and you can onboard all of your peer-to-peer support initiatives into that one blueprint, so they all function in the same data collection, showing your outcomes. And then we've got your ManBassadors. Your ManBassadors are there to achieve the mission together through ownership, promotion, and engaging their peers. We engage them, we train them, and then onboard them. So this is to make sure that before we wave them goodbye, your ManBassador program is fully integrated. We're there to provide ongoing support, development, and training. Of course we are, but this is really about making sure that it's owned internally by your men's health ambassadors. So, as way of an introduction, we now have Simon Ashcroft, who is from Tracerco and is one of the ManBassador leads. So he's kind of the deputy lead for the Tracerco ManBassador team, who's just going to tell us a little bit for the next kind of 5-10 minutes, just around, you know, why Simon wanted to become a ManBassador, what they've been doing at Tracerco already this year since they launched the programme, and what are their plans for 2024. Hi, Simon.
And obviously apologise for being really late to the party. So we're in the middle of our safety stand-down week. So really crucial time for the business. Certainly for the ManBassador programme as well. Gives us a chance just to speak for a full week about safety and wellbeing. So it's a massive initiative from the business. I think what Emily had touched on initially, that we need to drive this programme from the top. So our senior leadership team sponsor is a guy called Tom Larson. So Tom, when kind of we approached about the whole ManBassador program and kind of why we wanted to do it. So a little bit about Tracerco. So Tracerco is a global operation. We've got 21 bases globally. However, we send some of our staff, because we work in the oil and gas industry, into kind of the remotest of environments, sometimes the harshest of environments as well. So having a point of contact where any time of the day, these guys can reach out to should they need us. So, and 70% of our staff are male. So having a point of contact specifically for our males has been really good. Initially, when the program started, we've had, I think, 4 occasions where staff have already reached out. Ultimately, we don't want anybody to reach out, but at least they know that if stuff is happening, there is a point of contact for them to reach out to. So for us, about the ManBassador program, certainly for 2023, we've had loads going on as a business. So we've recently divested. We're from Johnson Matthey, so now we're a standalone business. We hold at least a regular monthly session for all our ManBassadors. So we have a catch-up session once a month where 2 of the ManBassadors take a lead on kind of a project. So then we're kind of there just to design, kind of raise awareness about the 5 biggest killers. But we've got a kind of a diverse calendar as well. So we look at kind of where that kind of fits in with men's mental health and kind of tailor kind of our talks around what them is. But for us as well, so yes, the program's aimed at males. We do encourage females to get involved as well. So it's not purely, our session's not all aimed at males. We also do encourage females coming in, specifically for obviously that be kind of their primary support for kind of their partners. So we can raise awareness kind of what them are doing, kind of the issues what they might face as well. So that's it. So for 2024, I think we've got loads planned. So we've got so we launch our calendar for 2024 in the end of December. So we have a full program of events going forward for next year. Lots and lots of, I think we're going to touch on trying to get a ManBassador football tournament going. We've got some big plans for that. Hopefully we can get a big stadium to kind of host that. So that's in the pipeline. Hopefully get all the ManBassador teams together and kind of go around all the different industries as well. So we're quite fortunate within Tracerco. We've got a lovely building to work in. It's a state-of-the-art building. So having kind of representatives from all the ManBassador teams coming on site, showing them what we do. So kind of a good lessons learned platform. So what's worked for us, what hasn't worked for us. Not everything what we do within the workforce works. So we've got some good lessons. I think for our ManBassador team as well, it's so diverse. So we've got people who are massively into computers, to people who are massively into kind of the football, sporting side. So having that mix of people, we had so much interest when we launched the ambassadors to actually our staff wanting to become a ambassador. So we had to actually interview and kind of ask them why you want to be a ambassador, what you kind of bring to the party as well. So that took a long time to kind of tailor it down to these 10 people. So I kind of lead the ambassador program for Trace Go, and now we've put loads of kind of support and stuff in as well. So we've got all the designated safeguard leads in place now. All our frontline managers have all been assessed as well. They've all been given the training from our mind as well. So they all kind of frontline first aid training, mental health first aid trained as well. So massive program, but a massive commitment from the Trace Go business. It's a massive, so it's been driven from the top and kind of, I think there. So we're currently in November phase, so we've got some absolute cracking tashes at the minute. So we're doing kind of the QR code. So you'll see all the ambassador teams walking around with the QR codes, looking for any sponsorship what they can. So I think currently about £250. So the company have said whatever we do, they'll match. So at the minute we're currently at about £500 with a match fund. So it is working. It's a great program to be involved in, but I think it's really important just to get people talking. I think that's where we're severely lacking as males, that we don't really talk in the same way as kind of what females do. Has anybody got any questions?
I have a question for you, Simon, because I think, you know, the engagement piece has been quite interesting as well. And I know you're doing loads around the worst mustaches start the best conversations, you know, around the Movember piece. But I know you found other quite unique ways to engage your male colleagues, especially around mental health. Haven't you invited the police interceptor from Channel 4?
Yeah, so as part of our safety stand down week, we then, for me, I love police interceptors. It's kind of the job what I'd always wanted to do, drive the police cars, but I've never really been very good at kind of arresting or anything like that. So I'd probably make the worst police interceptor going. So we've got a guy called Ben Pearson coming in. So you'll have seen Ben on the Channel 5 program, Police Interceptor. So Ben was part of the elite road policing unit for North Yorkshire. So he kind of is going to share his story. I don't know if you go on YouTube and type in Ben Pearson, his story is absolutely heartbreaking because he speaks about the job, what finally breaks him. So he's dealt with multiple kind of fatalities, crashes, some involving children as well, which for anybody must be absolutely horrific. So kind of he uses kind of the backpack analogy. So when your backpack's full, you kind of know this is it. And he actually broke down whilst dealing in a road traffic collision where he just literally said, enough's enough. So Ben has kind of reversed that and made it a massive positive. So he's released 2 best-selling books. He's a massive mental health kind of advocate for post-traumatic stress, certainly within emergency services as well. So that's a session, I think, at the minute we've got 380 people signed up to that session. With a workforce of 450, it's going to be the most attended session, I think, in kind of our stand-down history. So I think it's going to be really, really good.
That sounds amazing. That sounds absolutely fantastic. And like you say, it's just making it relevant, isn't it? And what is of interest, but with the kind of premise that that's the hook to get people there. And
the best thing we did was buy a pool table.
Okay.
Honestly, we spent I think about £600 on a pool table. And the amount of conversations what go on over that pool table is absolutely frightening. Yeah. You've got people there who you wouldn't necessarily see day to day in your workplace. You'll see a little team message pop up. Have you got 5 minutes? Absolutely, mate. Let's go and have a game of pool while we talk. But just getting that conversation, honestly, it's the best purchase we've made as a business, our pool table. So on Wednesday, we take completely the full day out of the calendar. And we have a local day. So we're in the gym from 8 o'clock in the morning. So we raising money for Cash for Kids. Brilliant. So for every kilometre, what kind of our staff raise, the company will match. We've got a pool competition going on, got loads of interactive sessions. The ManBassador doing a Wellbeing clinic as well. Yeah. So all the blood pressure monitors is kicking about. I think everybody's scared to use them, but I'll be there, obviously, 8 o'clock in the morning trying to set the example. Hope I can still go in the gym afterwards, but a really, really good session hopefully tomorrow.
It's amazing, Simon. And like you say, being a great positive role model. And that really is the power of what ManBassadors are doing. You know, none of this stuff would work without really great, you know, people like yourselves who are so passionate about this and improving mental health and well-being for yourselves and your colleagues as well. So, you know, absolutely amazing. Thank you so much, Simon, for joining us today. Does anyone have any further questions for Simon just before we end the session? My question is, where's your more, Si? What happened
honestly,
to it?
right, I am far too vain from. I've got no hair, so I'm not putting a tash on. I look like a big egg if I had a shave. So that was I'm doing the 60 kilometers, so that's what I'm going to do in the gym tomorrow.
Right.
So great. Part of November was either grow one of these horrific tashes or cycle 60 kilometers. So I'm going to do that in a day, hopefully tomorrow. That's if I survive. So
that's
I might not be here at the end of the day.
Yeah. We had a conversation just at the start with another attendee today about that exact same thing. It's not on my head, it's on my face. That's where it's all going to stay.
Yeah, absolutely.
Thank you so much for joining us today, Simon.
I'm going to have to drop off because I've got to jump on another session 10:30.
Brilliant. Thanks,
Simon.
For your
time, everybody.
Thank you. Thank you.
Bye.
Thanks. Cheers, Simon.
Thank you, Simon. I'm just going to finish off our session today, you know, perfect timing, which is great. Just to let you know, just some of the other organisations that have signed up to the ManBassador programme. Blackpool Council, as you can see here, they launched their programme in a boxing ring. So we had a little bit of a session with Brian Rose, who is just retired professional boxer from Blackpool. So he came along and became a really great advocate for the ManBassador team there at Blackpool Council as well. And it was also supported by the health director from Public Health England as well, which was absolutely amazing to see. What else have we had going on with other ManBassador teams? You know, the conversation is, we can't get the guys there. Well, you know, I think one of the things that we've learned today is we've just got to make sure that it's relevant and it's engaging, and that's the power of the ManBassador program. Is James Jones and Sons Limited. They're based up here in the northeast, the same as Tracer Co as well, and they had a competition, 5-a-side competition between Falkirk up in Scotland and their Durham site here as well. As you can see, loads of guys there, and you know, it's just amazing to know that this is happening and ultimately is beginning to save lives. Our last slide, I think we're on Kev. Any final questions for Kev or myself before we kind of let you go off to enjoy the rest of your day? Please feel free to unmute yourself or just pop something in the chat box. What we're going to do from today is, I can't see anyone. Has anyone got the hand up or anything, Kev? Thanks, Grazia. Thank you for saying that those insights are going to be really beneficial for you. Brilliant. Okay, so we're here to help. Yeah, we don't expect you to be experts. It took us 2 years to develop this program and do all of the research. Engaging, guys. So please do get in touch. If you need to have a chat about what do you need to do internally when it comes to engaging your male workforce as well. Next steps, really, if there's no other questions, is I'm going to follow up with an email which will give you information about 4Bs, which was the Blokes, Brains, Balls and Brawn session that we talked about earlier. I'm also going to provide you information on the ManBassador program, which links in there. What you've also heard today is the power of making sure that your managers have the knowledge, skills, tools and behaviours to create and foster healthy workplaces and teams for prevention, but then also making sure that they're having conversations around health and well-being, especially in male-dominated organisations where there'll be a lack of manager development on people skills like active listening skills, leading with empathy, and making sure that they're providing support during those conversations. So there's some really important areas that you see is much broader than just the ManBassador program, and really fits into your wider mental health and wellbeing strategy as well. I'll also send you the link for the petition to help us to really get that men's health minister into government. Is so crucial if we really want to turn the tide on that 1 in 5. And I think all of us here today will know and say from ourselves, we've all got brothers, husbands, fathers, male friends. It's so important that we are there, and we're there as ambassadors and allies for men as well. So we'll send you all that information in the email, and I'll just pop a little link in if this is something that you'd like to explore in a little bit more detail for your workplace. Then do book in a little bit of a chat with me, myself and Paul, and we'll have a conversation to see how this could work in your organisation. Thank you so much for attending today. I'm glad you found it interesting. We're here to help, because ultimately we're on a mission to improve men's health together and ultimately save lives. Thank you everybody for joining today. If you do want to follow us on LinkedIn, we've got them at ManHealth, at Our Minds Work. I'm at Emily Pearson. So please do get in contact, and let's keep this conversation going. Thanks everybody. Thank you. Have a great afternoon.